Hi, I'm Stephanie Shelton, and this is Conversations on Health, How We Get There. It's episode 13. Talking about healthcare systems doesn't really have much meaning unless you know how they actually affect people, real people, patients. So you've met a few of my friends on this podcast talking about their experiences and their hopes for the future, both here in the U.S. and in Europe. Right now, I'd like to introduce you to another friend. Her name is Gina Mžourek, and she's an American from New Jersey. She currently lives in Germany with her husband, but over the past 24 years, she's also lived in the Czech Republic, France, and of course the U.S. Gina has a chronic illness, so she's really good about comparing healthcare systems. They're all state-run, of course, except ours here in the U.S., and we talked on Zoom this summer. I was in Prague, and she was in her little village in Germany. The currency there is the euro, and right now the euro is worth just a little more than $1. I also gave her a sense of the questions I'd asked so she could make the comparisons, and I think you're going to find her insights are really, really interesting. Gina, thank you for coming on the podcast, and we should have an interesting conversation today.
Thank you for having me, Stephanie.
So tell me first, you're somebody who's an American, you grew up in America, and now you've lived 24 years in Europe, going back, obviously, for your family. What is your sense of and this is very broad, your sense of the medical system, U.S., the countries you've lived in a sense of ease of use and ability to pay for what you need?
So I've lived in the U.S., as you said, American, France, Czech Republic, now Germany, and I believe that's it. It's enough. And France, I was in school, so I had student health care, so I didn't really see it, and I was a lot healthier, I guess, because I was younger. Czech Republic and Germany, I find the healthcare very good. It's considered more socialized healthcare. They cover a lot, whereas in the US, I had to pay a lot. Or my parents, I was covered by my parents. They both had very good health insurance. They still do, which is a benefit at their age. My dad is 86 and my mom will be 79 this year. I have an ongoing illness, ulcerative colitis. I've had that for almost 32 years. I also calculated all these numbers for you. And in America, I found it much harder to find doctors and not to pay for the medicine, but the medicine is much more expensive. The co-pays are much more expensive. So I'm really happy with the European system. And that said, every country in Europe is different.
Is there anything you don't like about the systems over here? And as we're recording, I'm sitting in Prague. In the sense of, do you ever feel you don't get the newest drugs, or you don't get the newest procedures, or some of the doctors may not be as well trained as perhaps you could find in the US?
I feel it's really individual. Sometimes it's very frustrating because actually you have to speak Czech, or you have to speak German, or you have to speak French. In France, it was a bit different because they did have English-speaking doctors for the students. But in Czech Republic, it's much better now. English is much better. I arrived January 1st, 2004. Before they were officially in the EU. And I did have doctors who could speak some English, so that was great. But I do feel that the doctors aren't paid enough here, but I do feel that in America, they're paid way too much. Here, however, I had some experiences like recently in Germany where I needed to go to the orthopedic quite quickly. And it's a 1.5 month wait. Which when I say that to certain family members in America, they're like, actually, that's not that bad. But the doctor has everywhere written, you have 7 minutes to say what you have to say, because the health insurance pays only for 7 minutes
Wow.
of the time he spends with you.
Wow.
So, and he's a great doctor, and he gets everything done in these 7 minutes. I'm sure if you go over 7 minutes, but as a non-native German speaker, to spit out everything in 7 minutes is very stressful.
We get 15 minutes now in the US.
I didn't know there was a time.
Doctors to do it all in 15 minutes. And a lot of doctors are, quitting private practice partially because of that, going to work with hospitals similar to what you find in Europe with salaries, because they get, they're tired of being told this patient needs a little more time. It's complicated. Mm-hmm. Do it. You have to hit it, as you go through the day.
I do think that in the US, because of the salaries for doctors, I just really feel sometimes it's more like a factory for me. And that was my experience when I lived there, between France and Czech Republic. I went to Johns Hopkins. I was living in Baltimore at the time when I got back, and I went to see a gastroenterologist. I was recommended to go to Hopkins, of course. I went there. I was an hour early. I was in the wrong side of Hopkins. The information center called the gastroenterologist, said that I'm coming, but I might be late. And I got there, and it was nearly a few minutes over the appointment time, and he wouldn't see me. He didn't want to see me. I started crying. Like, no one should have to cry when they're in a lot of pain and suffering to see a doctor, that you were there in time, but weren't given the exact correct instructions, because Hopkins is big.
Yeah.
And in the end, he saw me. He kind of apologized, but still the appointment, like, you going there for help, you feel like you don't even want to speak to the doctor anymore, because the help that you wanted is kind of tainted in a way.
So I guess we have the same problems on both sides of the ocean, in a sense.
Mm-hmm.
Partially because as time goes on, I think healthcare is just getting more and more expensive. And the only way they can think of paying for it, I guess, is speeding up the process.
Mm-hmm. It's sad, because people make the world go round. So if people are sick and you're not helping these people, then how do they expect, the continued workforce, everything that makes the world starts with the environment and people. So it's not a good situation, in my opinion. You had at one point asked me where I would want to live, like preparing for the interview, if I was really sick, or where would I want to be? And I actually would rather be in Europe than in the US, because I've had really good healthcare here, and I've had really mean doctors. In Czech Republic, I don't even know what my temperature was. I had such a high fever in the middle of the night. My husband took me to where we thought was the closest hospital. We had no idea there was another hospital. We went to motel, and they were screaming at us that we didn't have a thermometer and didn't know what temperature I had. I was on fire. And I completely forgot about this incident. But then I've had other cases in Czech Republic where in the middle of the night, I felt like I was dying from my colitis, and Zdeněk called my doctor at 4 a.m, my husband, and the doctor didn't answer. But at 5:30, when he woke up, he already had called Zdeněk 5 times to find out what was wrong and where I could go. So it's just really individual. My experiences are individual, so good and then so bad at the same time.
I would say that is probably true everywhere. I mean, just somebody has an MD after his name or her name does not make them a caring individual, maybe interested in the process of the medical specialty that they're with. I mean, you're still dealing with people because we've had those experiences. The ones with the caring, and I've never had a medical experience outside of the US, but I've had the caring doctors and the ones that are just on the schedule and they tick you off. You're finished and on to the next. So I can't say the medical schools train doctors for any of this, so I can't imagine that they would. So it must just be who you are and how you run your own practice.
I don't know the average cost, but I did look up that in Germany, they contribute 12.8% of the GDP to healthcare, and that is about 5,000 euros per inhabitant each year. I don't know how much in Czech Republic it's contributed. I don't know how much in the US. Here, the German, if you are employed, the self-employed is completely different. You pay 14.6% of your income to healthcare, but your employer pays half. So it's split 7.3% for each employed or employed person. I think that's quite a lot, but I also think that the US, the main problem with the US is we are a huge country. I looked up as well, 331.9 million people compared to Czech Republic with 10.5, and Germany is like around 88 million or so. So I think it's really hard for the US to have a better healthcare system because there's so many people, and that doesn't include people that are not on the radar. But
it's not so much how many people there are, it's where they're living, and because if you fall below the poverty line, you're not paying for your health care. Medicaid is, but Medicaid is a state plus federal system, and although states are supposed to put into it what the federal system does, most of them don't. If they're southern states, for instance, or some of the western states, whereas some of the Atlantic coast states or California might put more into their Medicaid system. So you can move across the country here in the Czech Republic, and you're going to get, maybe not in the rural mountain areas, but in general, if you live around one of the cities, you're going to get pretty much the same healthcare. And if you live in America and you live in a rural area, you might not get any healthcare because there might not be a hospital for many, many miles, and there may not be a doctor on call anywhere near you. So it really, it's the luck of the draw in terms of where you live. And I would say probably here there's less of that. You're not living in a big city now. You're living. No. Is it a town or a city?
It's a town. There are about 30,000 inhabitants here. And that's another aspect, that there aren't enough doctors. There are not enough doctors, not only in our town, but in Germany. And they are recruiting doctors from other countries. For example, former Yugoslavia, because they are paid better here, but they just don't have the doctors. They don't have the doctors here. They just don't. There's not enough. So in our small town, I'm not satisfied with my general practitioner. It's a practice, which includes many doctors, of course. Normally, that's not the case in our town. Usually, it's one doctor with his own practice, and the hours are crazy. They are only open mornings, for example, 3 days out of 5 days a week. So the positive thing with this practice is they are open almost nonstop Monday through Friday from like 7 to 6, I believe, 6:30. And that's helpful when you need something done, or there's an emergency and you need, I don't know, I need blood work for something the next day. the other doctors, I think I tried 2 general practitioners here, and this is the 3rd, but I'm not happy with them. But in a small town, you have limited choices. Do you want to spend your time and energy driving somewhere else to a bigger town in a bigger city every time you need to go to a doctor? It also depends on how sick you are. Like, I'm not often that sick with my normally with my colitis in the past years. It's gotten a little bit worse, but in the small towns, your choices are limited. I've also went to 2 different gynecologists here that I was not satisfied with at all. The one I was satisfied with, and then there was an incident where I was shortly pregnant, and he didn't want to do the checkup where I had been going for IVF treatments, and they requested that, and he said, I can't just do the checkup. I need a letter, like a letter with a stamp. Like in Czech Republic, they love the stamp. They love the stamp here as much as well. Mm-hmm. And so after that, I felt like I don't want to go back to this guy. So I think in these small towns, you kind of have to do a Goldilocks and the 3 bears, You have to try a few times before you get the right one.
But at least you have the ability to do that. You have people to choose from. Mm-hmm. Again, it isn't like the US in a small town where either you drive huge distances to one of the big hospital systems, or you one doctor between 2 towns, and that's it. You're lucky. Have you ever tried telemedicine, and do they even have it here?
I have never tried. I don't know if they have it. That was established more during COVID, or I know my sister has tried with my mom this type of, that was during COVID, but now I think everyone has switched back to going regularly to the doctor, seeing them in person.
That's another question. Do you have any limitations? I mean, you pay into I'm thinking of the British system. You pay into the system through taxes, and then all care is free at the point of service. And you can basically go as often as you need to, and as often as you need an appointment. Over there now, you can't get the appointments. But if it were working as the national health system was set up, whenever you need to go, you can go. Is that true with you here?
I believe so. I haven't had any problems with that. The copay here, you pay no copay for the doctors here. You pay only copay in the pharmacy, and that's €5.
The same for every drug?
Not for every drug, but for example, the drug I use for my colitis is €5 per prescription. And in America, when I was there between France and Czech Republic, I was paying $25 copay with Blue Cross and Blue Shield of California. And that later, right before I was leaving to Czech Republic, someone informed me that if you did it by mail, you got like a bulk of the pills, and then that would make your cost less. But no one shared that information. And I kind of feel that that's the case in every country, that if you don't know someone who knows something, unless you really study the health insurance or you have a representative that really helps you, you don't know what you are allowed or what extra benefits you have. Or here you can pay less for the copay. Sometimes the copay is less, but in most cases it's $5 or you pay more.
€5.
Or €5, sorry, yes. And they also have here like 2 different types of prescription, which I couldn't remember if they have that in Czech or not. I even have one here for you. So they have a green one. And this green one basically is from the doctor saying that you need this, but is not going to be covered by the insurance. However, you can use this on your taxes. You can submit it in your taxes and the money will come out. What is the difference? I guess just the government will be paying for it as opposed to the healthcare company. But the healthcare company, okay, they are private in a way, but they are still funded by the government. So in this case, it was 44 euros and 38 cents I paid. And this will go off of the 2023 taxes for my husband because he is self-employed here.
And you don't have to have a certain amount of medical expense before you can deduct it.
No. Actually, no, that's not true. I don't know the amount, but the amount is quite high. And what we were told in the beginning is that if you have no kids, you will rarely make that amount to have the deduction. However, because of the IVF we were doing, because of my colitis, because of all of these other things, we have always made that deduction. So it's always come off of our taxes. It's
quite high in the US. You'll never make it with doctor's appointments and stuff. It would have to be an expensive co-payment for a drug or a procedure or something like that. So most people don't get to ever deduct it. Let me go back to the prescription drugs. Have you ever felt or have you heard of a new drug that comes out that's very, very expensive that you or anybody would have difficulty getting in either Germany or the Czech Republic because it's so expensive that they, in a sense, ration it to only the people they feel it will benefit the most?
I have not. I feel that the drugs come just around the same time. The only difference is I think that the costs are lower. I think that the pharmaceutical companies charge much more in America. That's just a guess. I have no idea.
No, it's true. I mean, the US cannot bargain with the pharmaceutical companies. Medicare can bargain on some drugs.
I feel that the problem, I feel like the American system could be really good if the pharmaceutical companies didn't want so much money. Like, I don't know. It's just, it's, I understand things cost more, but they don't cost that much more there. And if they're willing to sell to other countries so much for so much less, then how is that? It's not fair. Mom said always life is not fair. However, your goal should be to help people, not to make it harder for them to be healthy and be well.
Well, again, it's government policy. Government, Republicans and Democrats have let the drug companies, in a sense, set their prices. And they figure the marketplace will take care of it, because if an insurance company will not pay that price for, the people, and you have to have an insurance company of some kind or another. So if the insurance company won't pay that price, eventually the drug companies will pull it down, because then only the very rich can afford the drug. And I guess over a period of time that happens. But in the beginning, if it's your illness and this is a life-saving drug and it's new and it costs, $300,000 a year, which is not surprising anymore, the new drugs, you can't pay that, an average person, and the insurance company won't pay.
I think for my mom, some of her prescriptions, she has Alzheimer's and she also has a thyroid problem. I believe the last time I was in the States in April and I picked up her prescription, one of her tablets was only a few dollars, the copay. So I know, because she worked for the government for so long, she is considered in the old system, as they say, and she's very lucky, because the majority of everything is nearly covered for her. She still has to co-pays for the doctors and stuff, but not something like whereas my sister would go and get a prescription, or, even my father, as he was a teacher, and he was also he's also a veteran, the veteran should also be taken care of, and their medicine, from what I've been told, is more of a socialized system.
Yeah, the Veterans Administration runs a separate parallel system, and it's fully paid by the federal government. So good system or not, you're going to get arguments on that, but nonetheless, that's how it's set up. Gina, if you were, we've been talking about the good and the bad. If you were dictator for however long it takes, and you could combine the best parts of the health systems you've dealt with, including the US, what would that be? What would those, not how would you put it together so much, but what would be the elements that you pick out, the best ones?
I found this question very, very difficult. I must be honest. I was thinking about it a long time. And I like that you can have family healthcare in the US and in Germany. In Czech Republic, it's not the case. So you always have to be employed or at the unemployment office registered, and it's very stressful. This family healthcare, I believe, is really important. I believe that it's a very good thing that both countries do. However, the cost of healthcare in Czech Republic is so low that it's affordable for everyone, more or less, I would say. And I think those two aspects. And the third one, which is not so common, I believe that doctors should be trained for not only this medical medicine. I believe that they should be trained on how to be a human, actually, and work with patients. And also, and that's a huge generalization. As I said, I've had really good doctors in all three countries. That's not, I don't want to get any ruffled feathers or anyone's feathers ruffled. But I also believe that they should study more homeopathic methods. That I believe that the combination between pharmaceuticals or chemicals and what's already in this world, like herbs or, for example, roots and teas and things, I believe the combination of those two things would make like the perfect healthcare. The family care, lowering cost, and then more empathy and more, not just studying like a machine. Okay, this drug does this and this does, and I think that's one of the biggest problems is that through all of these countries, no one really accepts that there are alternative ways to getting around different illnesses.
Well, that's probably true. It's true in the US, absolutely. But you do have alternative doctors. You just don't get the ones that combine both. So that's interesting. I've never heard anybody suggest that.
There is one doctor here on my street, actually, that does. She is an official like homeopathic doctor or alternative care, as they call it, as well as studied medicine, like for the qualifications here in Germany. However, she's very hard to get into her practice without wanting to pay. She would like you to pay a first meeting of 60 euros, and then maybe you could go into her, be a patient from her.
What do you mean pay it at the when you
she wants homeopathy or the doctors, I guess they're called more homeopathic doctors, or like natural doctors here, as they call them. They are not covered by health insurance, but again, you can put that, you will get a receipt and you put it towards your taxes. So it's usually around 60 euros per hour. So she is full. So when she is accepting new patients, it's not that you would have to pay 60 euros. It's fine. But until then, she said, if you want to come and you have one session with her, you will pay the fee. And then later on, you can kind of wiggle your way into her practice.
You might find more of that here in Europe. It's grandma's way in a sense, What I didn't ask you is, so you've talked about the percentage that the government contributes to healthcare, basically, and you by your taxes contribute. We also talked about the fact that procedures and drugs are becoming, in general, more expensive because more complicated, and they save lives in cases where they weren't savable before. That seems to be the trend in medical care. Is there any effort here to turn it in the other direction so that you won't get sick, so you won't need the expensive drugs? In other words, put healthcare at the basis of everybody's life. Eat healthy, exercise, keep your weight at a normal place. The things that cause the other illnesses to develop. Is there emphasis on that as a way of saving money as the systems become more expensive?
As far as the US, I don't know. However, here in Europe, I know in Czech Republic at the time, they did have VZP, the national health care that most people are covered under, did have, for example, these, let's say, promotions that if you went to a yoga class, you would get some of that paid for. And that was years ago. So I don't know how much they have now. The insurance company we have here, they have a book, and not many people, of course, maybe not many people know about it. We didn't know about it right at the beginning. And in this book, they are saying a similar system, like you will get points. You can do that as a couple or as a family if you have kids, and you will get points, for example, for going to your regular checkups, for the dental, for going for your regular gynecological exam, for certain things, plus doing a first aid course, plus doing some kind of a training also. And at the end of the year, you send these papers that you have stamps with to the health insurance company, and they give you some money or some points that you can buy something from their website.
So there's some effort, at least in that direction.
Yes, I also feel, I was also thinking yesterday, I haven't really been swimming. I'm a big swimmer. I usually swim by now at least 3 or 4 times a week in the summer. That would not be so easy in the US because it's so expensive. Our local pool here, which is huge, it has like the outside pool, I think has 2 different pools, huge, 3, one with a baby, and you pay 5 euros for entrance per day. And I think that that's really good because you have the opportunity. 5 euros is nothing compared to, for example, in Czech Republic, you'll pay around 100 and something crowns, 120 per hour, sometimes hour and a half, which is equivalent nearly of 5 euros or so. Whereas in the US, when you want the day pass somewhere, you're paying 20, 25, 30.
Yeah.
And I think that's part of this community where in Germany, it's a small town, it's true. So I don't know how it is in the bigger towns, but we go to a lake here and they charge you 4 euros to enter the lake. It's clean. It looks super. They have, there you can have a coffee or you can have your laptop and work. I think here in Germany, they're big outdoors people, like Czech Republic as well, but they put a lot of the tax money into making it easier for people who can't afford it. Whereas you get a membership for our pool here, 110 euros for the whole summer. And if you bring in an electric bill from one of the two companies, you get 10 euros off. So you can pay 100 euros. So they're trying to find ways to give everyone an equal opportunity to stay fit, I think.
All right. Well, it's certainly a good beginning and better than mostly we have in the US. Okay, so just to kind of wrap this up, one more question about costs, which would be if costs continue to go up, but if the system remains basically a good one and you're well covered, do you think people would be willing to pay more in taxes so that the health systems would have more money to work with as these costs go up?
I think they would. I think they would. I think in the Czech Republic, I think they will try and remain low costs. The copay there was like 30 crowns when I was there, which is what, €1. I think that people would accept that because the healthcare is relatively good. When you're retired here, I don't know how that works. It all depends if you're satisfied. I think that people would definitely pay more.
All right, and the last question would be the thing that almost every American who isn't a multi-zillionaire thinks about the minute they get over 50, which is,
oh no,
how am I going to pay for my medical care as I get older and it gets more expensive and we get the new drugs and our only system, which is Medicare, doesn't keep up. So those are huge worries that people want to put aside enough money so that they can pay for their medical system. I get the sense that people don't, and certainly here in the Czech Republic, I never hear anybody talking about that.
No, it's just, I think they're just used to the system, that they expect the system somehow to figure out a way to cover you. I don't worry that if I'm still here, but if I were in America with an ongoing condition, I wouldn't know what to do, to be honest. I wouldn't have the money to go to the coverage for the doctors. I don't know anything about Obamacare because I'm not there, so I don't know how and if it would benefit me. With my mom, even with her great pension, her great health care, we are still trying to figure out if we will manage a live-in for her as opposed to an assisted living home. I think that the problem is in America that there's no system set up, as you said, for the elderly. Like if you have worked your whole life, you put money aside, you have a good health care, you don't receive any benefits from the state or from the government because you did so well and you did that. And I think that's a huge problem there. You prepared well for your life, your retirement, and in the way you are screwed, actually.
Yep. Yes.
And I that's very, very opposite of here. I feel that the people are more or less well taken care of, but the system is different. A lot of family members told me they don't want a socialized medicine because they associate that with a communist regime, but it's actually, it was just the Cold War time that it was put into place, and the history of it. Would I want to be in southern Italy where some of my family is from? No. The healthcare is horrible. But in northern Italy, you have a different case.
But northern,
I guess you'll have to interview me in 20 years, right, Steph?
Northern Italy
about how my healthcare.
Well, if you retire to southern Italy, it's cheaper.
It is.
Other than the medical issue. Okay, I think we pretty much covered it. And I think you were great. And
Thank you.
Put in a lot of good comparisons that I would not have thought of and concepts. So thank you.
Thank you, Stephanie.
My friend Gina Mžourek comparing her healthcare experiences in Germany and the Czech Republic to those in the United States, where her parents and her sister still live. Now, if you're on Medicare, the 6-week enrollment period to change or choose secondary or advantage plans begins in mid-October. It starts November 1st if you're looking for health insurance in the Affordable Care Marketplace. How do you navigate? Why do plans vary from state to state? And why is it all so complicated? I'll try to get some answers for you in podcast episode number 14. I schedule one new podcast episode a month, so look for this one in October. The drop day is usually the third Tuesday of the month. Updates wherever you get your podcasts. Now, I'd really, really appreciate it if you'd subscribe and share. We're on Apple, Google, Spotify, TuneIn, iHeart, Podchaser, and my host platform, the Podbeam app. The video version's on YouTube. Show notes and links on my website, www.stephanieshelton.com/conversations. I'm Stephanie Shelton, and until I see you again, please take care of yourself and all those you love. Conversations on Health, How We Get There is produced and edited by Frank Harold. Research assistance from Dr. Richard Saltman, Professor Emeritus of Health Policy and Management, Rollins School of Public Health at Emory University in Atlanta.